Hi friends, I am Dr. B.B. Rao of Kusha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the inflammations of the male urethra. Ulcers of urethral meatus in male children who are not circumcised, it usually follows circumcision. Lack of protection given by the prepuce may be the cause. Friction of clothes and the ammonical urine might be the etiological factor. The ulcer causes a scab to form, which closes the meatus, and the child can only urinate by bursting this scab. This process causes pain and screaming, and a few drops of blood passage. Ulceration and scab formation alternate, and if neglected, psychiatrical contracture of the meatus may result and lead to pinhole meatus. Treatment. A simple regimen of washing the napkin in boric acid crystals after boiling and applying 5% boric ointment locally is curative. These measures neutralize the alkaline urine. Few cases may require meatotomy. Urethritis. It is of two types, non-gonococcal urethritis and gonococcal urethritis. Non-gonococcal urethritis. It is an universal problem. An organism of the pleuropneumonia group has been incriminated, but at present this is considered not to be the cause, but an early symbiotic intruder. It may, in many cases, the infection is the result of coitus with a woman with leukorrhea or cervical erosion, and whenever possible, the female partner should be examined and treated. Otherwise, reinfection is possible. Undoubtedly, most of the organisms are the result of secondary infection. Diagnosis established by the absence of gonococci even after intensive investigation. Treatment. It is a self-limiting disease, so making the results of treatment difficult to assess. Urethral irrigation with oxycyanide of mercury in a strength of 1:8,000 and the temperature of the irrigating fluid is 105 degrees Fahrenheit. Given once daily for 7 days is successful in many cases. Antibiotics like oxytetracycline and spiramycin given orally 4 times daily for 5 days give good results. Furosin urethral suppositories quickly render the patient asymptomatic, but on withholding the treatment, relapse is the rule. Treatment failure may be due to misdiagnosis, urethral polyps, or trichomonal infection. Trichomonas vaginalis urethritis. There is an increasing incidence of its occurrence in men as well. The carrier of the disease is the male in whom the parasite causes no symptoms. In males, a small number of parasites present in the discharge, and the difficulty in finding them accounts for the non-recognition of infection and considered the non-gonococcal urethritis. It is only by examining at once a specimen of the discharge as a hanging drop preparation that this protozoa can be identified. Trichomonas vaginalis urethritis in males is difficult to eradicate, the treatment being handicapped by the high rate of reinfection, which emphasizes the necessary for treating the female partner as well as the male. Metronidazole 200 milligrams orally 3 times a day for 14 days proves to be successful. Reiter's disease. It is a venereal disease, starts as a subacute urethritis 6 weeks after the contact. The discharge is without organisms, being clear visit. A few days later, conjunctivitis occurs, at first unilateral and then bilateral. Arthritis. In 10 days, arthritis supervenes. Acute hydroarthrosis of at least one joint is present. Keratoderma blennoraezicum, consisting of nodules, vesicles and pustules, frequently found on the sole of the feet. Pleuropneumonia-like organisms have been isolated from various lesions of this condition. The urethritis and conjunctivitis subsides in few weeks, but arthritis persists for many months. Treatment. The ophthalmic complications must be treated thoroughly following the usual lines. There is no evidence that any form of treatment at present has any influence on the course of the disease. Various antibiotics and fever medication are induced by graduated doses of triple typhoid vaccine have been tried, the last being given for arthritis. That's all about the inflammation of the male urethra, and in the next video I will discuss about some other disease. Thank you.